Is it coming? Okay. Hello guys, good evening. Welcome to the class 4. Okay, class 4 on the pathology series. Now already we have completed what? We have already completed the first chapter, that's the cell death, cell injury and cell death is already completed. In last class we have begun with the inflammation. In the last class we have also seen the acute inflammation, right? What are the vascular events, what are the cellular events we have seen in detail. Okay. Now after that, before going to the next part, that is the chronic inflammation, before going to discuss about the chronic inflammation, about the granulomas and wound healing, I have decided to discuss some more important points in the topic of acute inflammation, continuing the acute inflammation. That topic which I am going to discuss now, let's begin with this topic, and after this we can go with the chronic inflammation. Now, come on sir. So, the topic which I am going to discuss now is inflammatory mediators. Okay. So, inflammatory mediators. Now, what exactly are these inflammatory mediators? Inflammatory mediators are those chemicals. These are the chemicals which aids in inflammation. Okay, which aids in the inflammation. In the process of inflammation, these chemicals are going to be produced. These chemicals, they will make the inflammation work in easy way. Okay. Now, having said that, what are the inflammatory mediators? What inflammatory mediators you want to know is, so inflammatory mediators are mainly divided into two types. They are cell derived. Okay, cell derived means cells are going to produce these mediators, cell derived and plasma derived. Okay, cell derived and plasma derived. Okay, now if you have any doubts, you can all the time put it in the chat box. Cell derived, hello guys, hello everyone. Okay, cell derived and plasma derived. Now देखो, these cell derived mediators are again further divided into two types. So cell derived are further divided into two types. What exactly are they? Preformed. Okay, preformed, which means, see, these mediators are always there. Okay, so even before the inflammation, cells contain, macrophages, neutrophils, they contain these mediators. Okay, so they are not produced at the time of inflammation, but from the beginning itself these mediators are there. So they are preformed and de novo. Preformed, and what the other type? It's a de novo, so newly formed. De novo means newly formed. Okay, newly synthesized. Okay, newly synthesized. So preformed mediators are newly synthesized mediators. Okay, so now plasma. So plasma derived. See, this plasma derived, it includes complement system, which you need to know for your exams, as well as clotting, coagulation. Okay, coagulation cascade. So these are the things which are going to happen during the inflammation, sir. Inflammation activates the complements. Inflammation, during the inflammation, the blood vessel clotting will happen. Okay, whenever there is inflammation, some tissue injury is there. Whenever there is tissue injury, you need to what? You need to do what? You need to prevent the blood loss. If you want to prevent the blood loss, clotting should happen, right? So for clotting, what are the mediators? We will discuss about that, okay? So now just tell me, the topics which we are going to discuss are inflammatory mediators. Okay, inflammatory mediators. Now, how many types of inflammatory mediators are there? The inflammatory mediators are broadly classified into two types. What are they? Cell-derived mediators, which are produced from the cells, and the plasma-derived. Okay, so some mediators or something is going to happen in the plasma which aids in the process of inflammation. Now, the preformed. What exactly are the preformed mediators? Preformed means they are there from the beginning. They are there from the beginning. What exactly are they? Histamine. That's your question in your exam. Histamine is an example of preformed mediator, and serotonin. Okay, serotonin. So histamine and serotonin, these are the examples of preformed mediators. Okay, then what are newly synthesized during the time of inflammation? What are newly synthesized? Newly synthesized mediators include, right, nitric oxide, okay, nitric oxide, arachidonic acid metabolites, right, arachidonic acid metabolites, okay. Next, chemokines, cytokines, platelet activating factor, okay, platelet activating factor. So these are the newly synthesized. These are synthesized at the time of inflammation. What are they? Nitric oxide, platelet activating factor, cytokines, chemokines, and even reactive oxygen species. Okay, reactive oxygen species. Those are the free radicals. So these are newly synthesized. Okay, they will help in the process of inflammation. Now, just tell me, just a broad classification. Inflammatory mediators are cell derived as well as plasma derived. The cell derived includes preformed as well as the newly synthesized. So which substances are going to be newly synthesized? Arachidonic acid metabolites, platelet activating factor, nitric oxide, reactive oxygen species, cytokines and chemokines. Okay, so these are the substances which are newly synthesized. Okay, having said that, now let's begin our topic with the preformed mediators. What are the preformed mediators? See, all the time they are there, sir. From the beginning they are there. So first, right, I am going to discuss about cell derived. Okay, they are cell derived, but they are preformed. Okay, preformed. What exactly are they? They are histamine and serotonin, right? Now let's discuss important points about the histamine. So histamine, it is produced from which amino acid? It is made up of which amino acid? Histamine. The name itself is there. Hista means histidine. So it is derived from histidine amino acid. Histidine, sir. Okay. Now what is the source of histamine in the body? Okay. So the most important source of the histamine in the body is mast cells. So mast cells are the most important source. Okay, means highest amount of histamine will be released by the mast cells. Not only the mast cells, platelets. Platelets are also going to produce a histamine. So histamine is produced by mast cells as well as platelets. And not only that, even some other WBs like basophils produces the histamine. Okay, sir. Now, what is the other preformed mediator? Other preformed mediator I have discussed is serotonin. The preformed mediator that I have discussed is serotonin. My question to you is, the serotonin, what is the other name for serotonin? 5-hydroxytryptophan. Okay, so it is derived from what? This 5-HT, serotonin, it is derived from which amino acid? It is derived, you know it in the name itself, just now I said 5-hydroxytryptophan, it is tryptophan. Okay, so serotonin is derived from tryptophan, right? Now, what is the source of serotonin in the body? Source of serotonin itself. Okay, histamine is produced by the mast cells. Okay, then who produces the serotonin in the body? Which cells releases the serotonin in the body? The serotonin is released by mainly the main source is enterochromaffin cells. The enterochromaffin cells are the richest source of serotonin in the body. Now, not only enterochromaffin cells but also platelets will also release the serotonin. Okay, guys. Now, dekho. Sir, you are saying us, okay, histamine is a preformed mediator, serotonin is a preformed mediator, but how they are going to help in the process of inflammation, sir? How exactly they are the inflammatory mediators? What exactly they are doing? See, during the time of inflammation, they are released just like that. Okay, they are going to be released just like that. Why? Because they are already preformed. So now what they will do? So these both serotonin and histamine, I am writing here, both combined. Okay, both this serotonin and histamine, what they are going to do is they are going to do vasodilation. Okay, so vasodilation is one of the vascular event during inflammation, right? Vasodilation. Okay, vascular event. Now the other event is increase vascular permeability. Okay, increase vascular permeability. Okay, so vasodilation, increase vascular permeability. In yesterday's class we have discussed increased vascular permeability is the hallmark of acute inflammation. Okay, so vascular permeability is done by whom? Histamine and serotonin will do that for you. Okay, and they can also do bronchoconstriction. Okay, so they are doing what? Bronchoconstriction. Inflammation, sir. Why? You can ask me why bronchoconstriction. See, our body is thinking that there is some thing, like there is some bad agent that is entering into the body. Okay, try to understand like that. See, there is some bad agent entering into the body. So that's why the airways are getting compressed in order to restrict the entry of that bad thing. Okay, maybe bad gas or some toxic gas or something, some poison. Okay, so that's the reason why. See, why the bronchoconstriction? You can ask me, sir, why exactly bronchoconstriction is happening? It's a protective response. The body is thinking that there is some noxious stimulus is coming through. So that's causing the bronchoconstriction. Okay, so anyway, histamine and serotonin, they are the preformed mediators. They will be immediately released just like that. And what are the things which will happen during the inflammation? Vasodilation, increased vascular permeability, and in lungs there can be bronchoconstriction. Now after this, let's discuss about cell derived only. See, now this is completed. So this part is completed. Okay. Now let's discuss about this cell derived only, but newly synthesized. Now these are going to be newly synthesized. Okay. Now let's begin. Cell derived, but newly synthesized. Okay, cell derived but newly synthesized. Now what are they? You guys already know. Just for recap, nitric oxide is one thing. What is the second thing? Arachidonic acid metabolites. Okay, arachidonic acid metabolites, and the platelet activating factor, PAF, platelet activating factor, cytokines. Okay, cytokines, chemokines. Okay, so these are the things now we have to discuss. Okay, we have to discuss about these things. Okay, these 5 things we have to discuss about. Now, tell me, what's the first thing? First, let's discuss about this nitric oxide. Okay, now let's write nitric oxide, sir. Hello, guys. Hello, Rain, fun mode. Yeah, be active. Okay, yeah, I'm good. I'm reading your comments. I'm good. Okay, so now let's discuss about the first one, nitric oxide. The first important MCQ is, so this nitric oxide, okay, this nitric oxide, it's actually produced where? So this nitric oxide, how it is produced is, the little biochemistry, I'm just going into little biochemistry, it is derived from an amino acid called as L-arginine. Okay, so there is this amino acid which is called as L-arginine. So this L-arginine, when it is acted upon by an enzyme called as a nitric oxide synthase, NOS, nitric oxide synthase. Okay, now I am asking you guys, tell me, how many nitric oxide synthase do you know? How many types of nitric oxide synthase do you know? See, when arginine is acted upon by this enzyme called as nitric oxide synthase, now this arginine, it will be converted into nitric oxide. Okay, it will be converted into nitric oxide. Okay, now my question to you is, how many types of nitric oxide do you know? So how many types of this enzyme, how many types of nitric oxide synthase do you know, guys? Any idea? Any idea, guys? There are 3 types. There are 3 types of nitric oxide synthase. Do you know what are they? First type is eNOS. Okay, eNOS, endothelial nitric oxide synthase. Second type is nNOS, neuronal. Okay, nNOS, neuronal nitric oxide synthase. And third one is iNOS. Okay, inducible nitric oxide synthase. Inducible nitric oxide synthase. So there are 3 types of nitric oxide synthesis in 3 different places. Now L-arginine, see, now when L-arginine, when this amino acid, it is acted upon by this enzyme nitric oxide synthase, it is going to be converted into nitric oxide as well as citrulline. Okay, as well as citrulline. Okay, citrulline. That's not important for us. My question to you is, sir, what the hell this nitric oxide will do? Sir, nitric oxide, it's acting on the cells. It's going to act on the blood vessels. I mean, it is acting on the blood vessels. It's going to cause what? Vasodilation. Now again, sir, it's doing vasodilation. So, is it going to helpful us? Is it going to help us during inflammation or not? Definitely, it's going to help us during the inflammation, right? It will cause vasodilation. So, more blood flow to the tissues, more neutrophils will come, more macrophages will come, more antibodies will come. Okay, more complement proteins will come, something like that. Okay, so it's going to cause the vasodilation. Do you know any other? Do you know any other functions of this nitric oxide, guys? Buddies, do you know any other function of this nitric oxide? Not only just vasodilation. It is anti-aggregant. Excellent. It's anti-aggregant, sir. Anti-aggregant. What exactly is anti-aggregant? It inhibits the platelet aggregation. Okay, inhibits platelet aggregation. Okay, it inhibits the platelet aggregation. So normally, in a normal blood vessel, see, in a normal blood vessel, we don't want any clots. In a normal blood vessel, we don't want any clots. So nitric oxide, what it will do is, it inhibits the platelet aggregation in a normal healthy blood vessels. Okay, so these are the two important points about the nitric oxide which I want you to know. Okay, so it is helping in vasodilation as well as it is anti-platelet aggregant. Now after this, let's discuss about the second mediator, second newly produced mediator, sir. Okay, now first let's discuss about it. At the end I will discuss about the arachidonic acid metabolites. At the end I will discuss about that. Now first let's discuss about the PAF. So what exactly is PAF? Guys, can you tell me PAF means? Platelet, the second one. Platelet activating factor. So the platelet activating factor. Now this platelet activating factor, what it will do? How it's going to helpful for us? This platelet activating factor. See, from the inflamed area, this platelet activating factor is getting produced. Now how it's going to helpful for us? It will do three functions. There are three functions which will help us during inflammation. Okay, one is it will do vasodilation, but in low concentration. It will do vasodilation, but in low concentration. Predominantly it will do vasoconstriction. So platelet activating factor is the one thing which can do both. In low concentration it will do the vasodilation, in high concentration it will do vasoconstriction. Not only that, during inflammation, tissues are getting damaged, blood vessels are getting damaged, you need to have the clots. So platelet aggregant, platelet aggregation. Yes, excellent. Platelet activating factor, in the name itself it is activating the platelets. So platelet adhesion, aggregation followed by clot formation will occur. Okay, clotting will occur. And next, do you know any other function of platelet activating factor? It's one of the powerful vasoconstrictant. Okay. Do you know any other function, guys? Rain. It will cause bronchoconstriction. Bronchoconstriction. Okay. So previously you have seen who is causing the bronchoconstriction. Ek baar dekho. Sir, bronchoconstriction is done by histamine. Okay, histamine causes the bronchoconstriction, sir. Okay, done. Now not only histamine, but also now the platelet activating factor is causing the bronchoconstriction. Okay, but I want you to answer, guys. Tell me, which cytokine do you know? Okay, just tell me that chemical which is the potent bronchoconstrictor out of all. Histamine, serotonin, like, so many things are there. Out of all the things which you know, which is the most potent bronchoconstrictor? Okay, which chemical will cause bronchoconstriction more powerfully? Do you have any idea? Do you have any idea, guys? Who will cause most potent bronchoconstriction? No, not histamine. That's what. No, not histamine, sir. The most potent bronchoconstrictor. Okay, let me write here itself. It will come again. Most potent bronchoconstrictor is leukotrienes. Okay, so leukotrienes before. Leukotrienes are the most potent bronchoconstrictors, sir. Okay, done. Now after platelet activating factor, now let's discuss about some chemokines. Okay, chemokines. Now from the inflammatory area, now these chemokines are going to be produced. Okay, chemokines. Okay, so what exactly are these chemokines if you ask me? So what exactly are these chemokines? So in the name itself is there. Chemo means chemicals, kines helping in movement. So chemokines are what? These are the chemotactic agents. Okay, they help in the they help in attracting the WBCs to the area of inflammation. Okay, so chemokines are nothing but the cytokines. They go. Chemokines are nothing but the cytokines. They help in movement of the blood cells or WBC towards the area of inflammation. Okay, so these are the chemo attractants, right? Chemo attractants. These are the chemo attractants. Now, how many types of chemokines are there? Okay, there are different types of chemokines. Like based on the structure, there are different types of chemokines. Now, let me write one by one. The first type of chemokines are called as C chemokines, C type. Okay, C chemokines. The second type is called as CC chemokines. The third type is called as CXC. Okay, CXC type of chemokines. And see, it's all based on the structure. What is RC? What is CX? Okay, it's based on the structure. We don't want to go in that much detail. So the fourth type of chemokines are called as CX3C chemokines. CX3C chemokines. Okay, these are the different types of chemokines. What all these chemokines will do, I will give you the examples. Okay, I will give you the example of every class. What is C chemokine, what is CC chemokine, what is CXC chemokine, what is CX3 C chemokine. I will give you the examples. Important, sir, important. Now, all these agents at the end of the day, they help in what? They help in movement, chemoattractants, chemotaxis kind of thing. Okay. Now, let's begin with the first C chemokine. Okay, let's begin with the C chemokine. Do you know any example of the C chemokine, guys? Fun mode, green, amazing joy. Do you know do you have any idea about the C chemokine? This is the first example I am giving you is it's a lymphotactin. Lymphotactin. One more, lymphotactin. Now you tell me, sir, this C chemokine, which is a lymphotactin, now tell me, it's going to attract which cells? It's going to attract which cells? Basic thing, lymphocytes. Okay, it's going to attract the lymphocytes. Simple, right? Now, can you give me an example of CC chemokine? CC chemokine, one more. CC chemokine examples are eotaxin. Okay, eotaxin, rantis. Okay, these are all examples. Okay, these are all examples. Eotaxin, rantis, and MCP. See, no need to go in that much detail. Okay, no need to go into the full forms. Sir, what I am showing you here is this lymphotactin is a chemical. It's a chemo attractant. It helps in the recruitment. It helps in the recruitment of the lymphocytes to the area of inflammation. And eotaxin, rantis, MCP, these are all examples of chemoattractants. Now tell me, eotaxin, the name itself is there. It's going to recruit what? Its cells? It's going to recruit eosinophils. Okay, it's going to recruit eosinophils. And rantis, these are going to recruit which cells? T cells. Okay, and MCP in the name itself is there. M stands for macrophages. So recruitment of the macrophages. So C chemokines example is lymphotactin. CC chemokines examples are eotaxin, rantis, and MCP. These are all examples of the CC chemokines. Now, CXC chemokine. What are the example of which? Say the NEET PG exam. This kind of questions might come in your exam. Which of the following is a CXC chemokine? Okay, which of the following is coming under the family of CXC chemokines? Okay, so it's the interleukin 8. Even in last class we have discussed interleukin 8, sir. Interleukin 8 is one of the important chemoattractant for the neutrophils. Okay, we have discussed neutrophils. Okay, and CX, last one, CX3C chemokines. CX3C chemokines examples are fractalkane. Okay. Okay, so this fractalkane, it's going to recruit which cells? It's going to recruit T cells and monocytes. So these are the chemicals, okay, which you need to know. First thing, chemokines are what? They are chemoattractant agents, sir. They are the chemoattractant agents. How many types are there? 4 types. C chemokines, CC, CXC, CX3C. Done. Sir, lymphotactin is an example of C. Eotaxin is an example of CC. Next, interleukin 8 is an example of CXC, and last fractalkine is example of CX3C. Done. Okay, and which cells they are recruiting, which cells they are attracting, I have given the list. Done, sir. So we have done with the chemokines also. Now after doing the chemokines, first listen, chemokines are what? They are nothing but the cytokines. They are nothing but the cytokines which are helping in the attraction of the blood cells. Okay, the WBC, different types of WBC. Now I am going to discuss about cytokines. Which type of cytokines? Now I am going to discuss about interleukins. Okay, first cytokines. The chemokines are also cytokines. Now which type of cytokines I am going to discuss about? I am going to discuss about interleukins. Interleukins. Okay. Now very important area. Lots and lots of times the questions will come from this area. Interleukins, sir. Okay. There is no such mnemonic. Okay, you need to buy heart it, sir. You need to buy heart it. There is no mnemonic, but in future I will try to make a mnemonic, sir. See, for me, just like, it's there in the mind. If you repeat it many times, you can, So out of this, if you ask me out of this one thing, sir, I want to remember one thing. See, this interleukin 8 attracts neutrophils. It is belonging to CXC. That's the question. Okay, that's the question, sir. Next, we are going to discuss about the interleukins. Now tell me, which type of interleukins do you know? Fun mode. Which type of interleukins do you know? There are many interleukins. Now, okay. Now, let's discuss about some important interleukins which are needed for your exam. Okay, from this chapter of the inflammation, which kind of question, which type of interleukins are most important? Okay. Now, fun mode. Just let's begin with the interleukin 1. Okay, interleukin 1. So this interleukin 1, what it will cause? So now there is some inflammation going on in the body. Now these interleukins are going to be produced. Okay, now interleukins are produced by different types of WBCs. Now these interleukins, okay, they are produced by the WBCs. These interleukins are produced by the WBCs. Now these interleukins are going to cause what? Interleukin 1. Can you tell me one important point about the interleukin 1? Interleukin 1 causes what? Interleukin 1 is a interleukin 1 is the interleukin. It is going to cause a fever. It's a pyrogen. It's a pyrogen, sir. Interleukin 1 is one of the important pyrogen. Even we have discussed this in the topic of the pyroptosis. In the topic of the pyroptosis, I have discussed caspase number 1 activates interleukin 1. Interleukin 1 causes fever. Pyroptosis topic. Okay. Now, interleukin 5. Okay, go and watch the topic. Pyroptosis is also very important for your exam. Interleukin 5, what it will do? Interleukin 5, it will cause eosinophil activation. Eosinophil activation. Okay, eosinophil activation, sir. Activation of the eosinophils, not the recruitment. Eotaxin is the one which helps in the recruitment. Eotaxin. Eotaxin is helping in the recruitment of the neutrophils, not the activation. Now, interleukin 5 helps in eosinophil activation, sir. Interleukin 6, any idea, guys? Interleukin 6, again fever. Okay, again it's going to cause a fever, and interleukin 6 have an important role in the regulation of the acute phase reactants. At the end I will discuss about the acute phase reactants. During the time of inflammation in our body, certain proteins will go up and certain proteins will go down. These are the acute phase reactants. So it's a regulation. Interleukin 6, one more important MCQ is, it's a regulation of, okay, regulation MCQ. Interleukin 6, it helps in regulation of acute phase reactants. Okay. Now for example, see, now imagine you are having some inflammation. Right now you are having inflammation in your body. Now we know C-reactive protein is going to be elevated. Okay, C-reactive protein is going to be elevated. So who elevates the C-reactive protein? Who increases C-reactive protein levels? Who regulates which interleukin regulates this? Interleukin 6. Okay, interleukin 6. Now after that, interleukin 7, sir. What it will do? It helps in the T cell maturation. It helps in T cell maturation. Okay, it helps in the T cell maturation. Interleukin 8. Where we have discussed interleukin 8? Just now we have discussed, sir. Just now. Interleukin 8. Dekho. Same interleukin. Say this interleukin, yes. It's also a chemokine. It's also a chemokine. It helps in recruitment of the neutrophils, right? So interleukin 8, what it's doing? recruits neutrophils. Okay, it recruits the neutrophils, neutrophil recruitment. And the last, very important, this is my favorite, sir. This is something special. Out of all the interleukins, this is something special, sir. Do you know what is that? Sir, interleukins normally they are pro-inflammatory, right? They are helping in the process of inflammation. Okay, they are helping in the process of the inflammation. Now, interleukin 10 is the one interleukin which is, any idea? Any idea fun mode? Rain, fun mode? Any idea? Interleukin 10 is anti-inflammatory. It's anti-inflammatory, sir. So in your future, if someone asks you which interleukin is anti-inflammatory, it's interleukin 10. Interleukin 10, sir. Now, it's only anti-inflammatory. It's only anti-inflammatory. So, say for example, say tissue damage occurred. Inflammation have started. Now, lots and lots of neutrophils came, macrophages came, complement systems are activated. Now, once healing occurs, everything is set right, sir. Now the bacteria is killed, everything is now normal. Now, do you want still the inflammation in this area? No. What do we want? We want to take out the inflammation from that area. So that is, who is going to do that job for you? Interleukin 10, anti-inflammatory now. Now anti-inflammatory will stop the inflammation. Okay. Next, interleukin 4 and 6. These are both pro as well as anti-inflammatory. So for us as a doctors, we have to know these basic things. Okay, basic things in the sense to clear the exam. Okay, I won't say these are going to be helpful for you in your clinical practice, but sir, we need to know this for clearing our exams. Okay, keep that in mind. So interleukin 1 is going to cause the fever, it's a pyrogen. Interleukin 5 for the activation of the eosinophils. Interleukin 6 for fever and regulation of the acute phase reactants. Interleukin 7 for T cell maturation. Interleukin 8 recruits the neutrophils, and interleukin 10 is anti-inflammatory. Interleukin 4 and 6 both anti-inflammatory as well as pro-inflammatory. Okay, so these are about these cytokines which we have discussed are the interleukins. Now, let's discuss about some other cytokines, other types of cytokines, okay, other chemicals. Cytokines means what? Cyto means cell, kines are the chemicals which are getting produced. Cytokines are produced from the cells, okay, inflammatory cells. Now, let's discuss about TNF, okay, TNF. So, how many types of TNF do you know? TNF alpha, you know about the TNF alpha, right? Now, similar thing, human necrosis factor, TNF means human necrosis factor, TNF alpha. Similar thing, sir, transforming growth factor beta, transforming growth factor alpha. Okay, let's put it this way, transforming growth factor alpha, transforming growth factor beta. Now, my dear students, come on, fun mode, Reen, answer this. So, TNF alpha is going to cause what? Do you have any idea what TNF alpha is going to cause in our body? It's responsible for which, inflammatory reaction. It helps in, how it's going to help us in inflammation, sir? TNF alpha, any idea? TNF alpha. See, let me tell you, TNF alpha, it's going to cause a fever again. So, where we have seen fever previously, sir, interleukin 1, interleukin 1 causes the fever, and interleukin 6 also causes the fever. So, now you should know interleukin 1, interleukin 6 as well as TNF alpha are going to cause fever, sir. And not only that, TNF alpha, if you want to remember one more point, so TNF alpha is going to cause cachexia, sir. Cachexia, weight loss, severe weight loss. Okay, cachexia, the cancer cachexia patients, TNF alpha is going to cause the weight loss also. Now, TGF alpha, transforming growth factor alpha. So, this transforming growth factor alpha, one important point for your exams. Okay, for your exams, the one thing which I want you to know is, this TNF alpha levels are elevated in a disease, sir. There is a disease in which the TNF alpha levels are elevated. Can you tell me the disease? It's a gastric problem. I will tell you what is the problem also. There is hyperplasia of the foveolar cells, in the stomach. There is this one disease where there is hyperplasia of the foveolar cells in the stomach, leading to cerebriform appearance of the gastric mucosa. If you look at the stomach, the gastric rugae, they will look like a brain. This is called as a cerebriform appearance. So now can you tell me what is the disease? The disease in which the TNF alpha levels are elevated, leading to cerebriform appearance of the gastric mucosa. So that disease here it's called as, okay, that disease it's called as Menintriers disease. Okay, that disease is called as Menintriers disease. Okay, and TGF beta is going to cause a fibrosis, sir. TGF beta it's going to help in wound healing fibrosis. Okay, mainly the wound healing, sir, fibrosis. Okay, so during healing, fiber deposition, healing should occur, right? Fibrogenic. This TGF beta is fibrogenic. More and more fibers, collagen fibers will be deposited, so scar formation will occur. Okay, so 3 types we have discussed: TNF alpha for fever, TNF alpha for cachexia also. Okay, cachexia, cancer cachexia. Now TGF alpha, transforming growth factor alpha for the Menintriers disease, TGF beta for fibrosis. Now after this, let's discuss about some more cytokines. These are called as interferons. Now, how many types of interferons do you know? I'm asking you. Reen, how many types of interferons do you know? Okay, same. Any idea? Any idea, fun mode, Reen? Any idea? Kashyap? Varun Kashyap? Any idea about the interferons? Say macrophages, let's write. Macrophages. These macrophages are going to produce an interferon called as interferon alpha, sir. Interferon alpha is produced by, yes, alpha, beta, gamma. Yes, 3 types of interferons. What are they? Interferon alpha, interferon beta, and interferon gamma. Interferon alpha, interferon beta, interferon gamma. My question to you is, sir, interferon alpha is produced by macrophages. Okay, sir. Then who produces interferon beta? Who produces interferon beta? So this interferon beta, it is produced by fibroblast. Okay, fibroblasts are going to produce the interferon beta. Then who produces the interferon gamma? It's the T helper 1 cells. Okay, T helper 1 cells. So macrophages produces the alpha, fibroblast produces the beta, T helper 1 cells produces the gamma, interferon gamma. Okay, now question to you is, in your exams, every time this, many times in your Viva exams they might ask you this, sir, macrophages produces the TNF alpha. So what is the function of this TNF alpha? So this TNF alpha function, exam point of view, sir, it is antiviral. Okay, antiviral. Okay, it's antiviral. TNF beta, for your exam point of view, one important point about this TNF beta is, so this TNF beta is actually, we synthesize this TNF beta and we use this TNF beta for the treatment of, which disease? There is a disease in which we use the interferon beta. Can you tell me? That is multiple sclerosis. There is a disease called as multiple sclerosis, sir. It's a demyelinating disorder in the central nervous system. Sir, multiple sclerosis. Now, in that disease, we use TNF beta. Okay, TNF beta. Next and last one, interferon gamma, sir. Interferon gamma. So, this interferon gamma is helping in, it is going to be mainly helpful during the chronic inflammation. During granuloma formation. Okay, during granuloma formation, sir. Okay, granuloma formation. So, done. So, the 3 type of interferons I have discussed. In your exam, they will ask you interferon alpha, interferon beta, interferon gamma. Interferon alpha is produced by the macrophages, interferon beta is produced by the fibroblast, and interferon gamma is produced by the T helper 1 cells. And their important points for your exam I have explained you. Okay, so these are also the chemicals which are going to helpful during the process of inflammation. No doubt. Now, after this, see, dekho guys, first let's look here what we are discussing. We have started with the newly synthesized mediators. Okay, newly synthesized mediators. Okay, cell derived cells are producing them, but newly synthesized. What we have completed, we have discussed about the nitric oxide. Okay, from L-arginine, nitric oxide synthase, 3 types of nitric oxide causing the vasodilation, antiplatelet aggregant. We have discussed about the platelet activating factor also. We have discussed about the cytokines and chemokines. Different types of cytokines I have discussed. Interleukins, okay, transforming growth factor alpha, transforming growth factor beta. Also we have discussed about the interferons. Now after this, last, let's discuss about the arachidonic acid metabolites. Okay, arachidonic acid metabolites, sir. Now I'm asking you, sir, arachidonic acid, where it is present? So this arachidonic acid, now let's write, come on guys, arachidonic acid, metabolites. Come on Kashyap, Panmod, Reen. Guys, can you tell me where these arachidonic acids are present? Arachidonic acid metabolites. From where it will come, sir? Okay, let's put it this way. From where this arachidonic acid will come, sir? Breakdown of which product? Breakdown of which product can give you arachidonic acids? So let me tell you. Okay, if you don't know, please look here. See, you are having all the cells, right? Okay, you are having millions and millions of cells. So the cells are made up of what? Cell membranes. The cell membranes are made up of what? Cell membranes are made up of proteins, lipids and carbohydrates, you know it. Sir, I am talking about the lipids now. What is the most important lipid? The most important lipid of the cell membrane is phospholipids. Okay, so now let's take this phospholipids. Phospholipids. Okay, so now in the cell membrane there is a phospholipid, sir. Now this phospholipid, it is going to be broken down. It's going to be broken down with the help of an enzyme called as enzyme. I will show you with a different color. It's broken down with the help of a phospholipids. It's sannyasi Pandit, you are true. These phospholipids are going to be broken down with the help of an enzyme called as phospholipase. Phospholipase. Okay, phospholipase. Okay, so phospholipase A2, the enzyme name is called as phospholipase A2 or C. Okay, phospholipase A2 and phospholipase C. Now, these phospholipids are broken down. In the name itself is there, phospholipase. Phospholipids are going to be broken down into what? Into arachidonic acid. Into arachidonic acid. Arachidonic acid. Okay. Okay, arachidonic acid, sir. Now, this is how arachidonic acids are produced. Now, they go, sir, these arachidonic acids, now, they can, now let me show you like this. Sir, these arachidonic acids, now they can go into 4 pathways. This one single arachidonic acid molecule, it's a raw material, sir. Now, this arachidonic acid, if it is acted upon by an enzyme called as cyclooxygenase, this is an enzyme. Okay, if this arachidonic acid is acted upon by cyclooxygenase, do you know what happens? Do you know what's going to be produced? Sir, prostaglandins and thromboxane A2. Okay, so just I'm giving you the blueprint, sir. I'm giving you the blueprint. Okay, so now this arachidonic acid, when it is acted upon by an enzyme called as cyclooxygenase, now prostaglandins and thromboxane A2 are going to be produced. Next, when this arachidonic acid, when it is acted upon by an enzyme called as lipoxygenase, okay, acted upon by an enzyme called as lipoxygenase, do you know who are going to be produced? Leukotrienes. Okay, leukotrienes are going to be produced. Sir, if the same arachidonic acid, if it is acted upon by cytochrome enzymes, cytochrome P450 enzyme, which is called as apoxygenase. Okay, cytochrome P450 apoxygenase. Do you know who is going to be produced? There is a molecule that's going to produce, which is called as, it's a big name, it's a big name. Any idea, guys? Any idea, guys? Now, this arachidonic acid, see, when this arachidonic acid, when it is acted upon by cytochrome P50 apoxygenase, then which molecules are going to be produced? Do you have any idea? Now let me tell you. Epoxy. Okay, apoxygenase, right? So epoxy, icosa. Okay, epoxy, icosa, trionic acid. So it's a very big name. You don't need to remember this much big name. You can simply call it as EET. Okay, EET, epoxy, icosa, trionic acid. EET, sir. Now, okay, done. So the arachidonic acid, sir, it is when it is acted upon by an enzyme called as cyclooxygenase. So prostaglandins and thromboxane A2 are produced. When the arachidonic acid is acted upon by lipoxygenase, leukotrienes are produced. When the same arachidonic acid, when it is acted upon by an enzyme called as cytochrome P450 apoxygenase, then EET is going to be produced. And last one, sir, last one. When it is acted upon by, okay, when it is going into iso-icosanoid pathway, when it is going into, it's a non-enzymatic pathway. Now when it is going into iso-icosanoid pathway. Okay, so icosanoid pathway, then do you know what's going to be produced? Any idea? Yes, icosanoid pathway. Isoprostane is going to be produced. isoprostane. Okay, this is how isoprostane is produced. Sir, isoprostane is the one which causes the vasoconstriction. Okay, it's going to cause the vasoconstriction. Now, if you ask me, sir, what this EET will do? Sir, EET is going to do vasodilation. So, these are the miscellaneous things. The last two things are miscellaneous things. Even if you don't know for your MBBS level, not a big deal. Okay, but the first two are very important, sir. First two are very important. So, what I am trying to put in your mind is, dekho, now, phospholipids which are there in your cell membrane, they are acted upon by an enzyme called as phospholipase A2. So this phospholipase A2 is going to break the phospholipids into arachidonic acids. Now these arachidonic acids, they can go into the pathway of cyclooxygenase, lipoxygenase, or they can enter into the epoxygenase pathway or isoicosanoid pathway. But the first two are very important, sir. First two are very important. See, when this arachidonic acid, okay, let's write the cyclooxygenase pathway. Now I am writing with the cyclooxygenase pathway, right? First, let's see, cyclooxygenase pathway. Okay, cyclooxygenase pathway. Now, in the cyclooxygenase pathway, what is happening? I will write from the beginning. Okay, I'll write from the beginning, sir. So, membrane phospholipids. What do you have? Membrane phospholipids. Now, tell me. So, this membrane phospholipids, they are acted upon by what? They are acted upon by phospholipase A2. Okay, phospholipase A2 or C, phospholipase C. Now, when they are acted upon by phospholipase A2, now what happens, sir? It's going, phospholipids are going to be broken down into arachidonic. Okay, they are going to be broken down into what? Arachidonic acid. Arachidonic acid. Now this arachidonic acid, now I am discussing that. Now when this arachidonic acid, it is acted upon by, guys look here, when this arachidonic acid, when it is acted upon by cyclooxygenase enzyme, when it is acted upon by the cyclooxygenase enzyme, then what happens? Sir, now what happens is this arachidonic acid is now getting converted into prostaglandins. Which prostaglandin? Prostaglandin G2. Okay, prostaglandin G2. Here I want to add one more point. Sir, how many types of cyclooxygenases do you know? There are two types of cyclooxygenases, sir. Okay, cyclooxygenase 1, which is normally physiologically active, and cyclooxygenase 2. Okay, cyclooxygenase 1 and cyclooxygenase 2. So both the cyclooxygenase 1 and cyclooxygenase 2, they are going to do what? They are going to convert the arachidonic acid into prostaglandin G2. Okay, prostaglandin G2. Now this prostaglandin G2, now it will be later converted into prostaglandin H2. Okay, prostaglandin H2 with the help of due to the process of peroxidase. Okay, with the help of this enzyme peroxidase, the prostaglandin G2 is converted into prostaglandin H2. Now, see what happened to this prostaglandin H2. Now, point is this prostaglandin H2. Now, if it is acted upon by an enzyme called as thromboxane synthase. Now, it is acted upon by what? Thromboxane synthase. Okay, thromboxane synthase. Okay, thromboxane synthase. Okay, thromboxane synthase. Now what happens? Thromboxane A2 is going to be produced. Now you understood how thromboxane A2 is produced now? Sir, in the cyclooxygenase pathway, the membrane phospholipids are broken down by phospholipase A2. Arachidonic acid is produced. When this arachidonic acid is acted upon by cyclooxygenase enzyme, prostaglandin G2 is produced. The prostaglandin G2 is converted into prostaglandin H2. Now this prostaglandin H2, when it is acted upon by an enzyme called as thromboxane synthase, now thromboxane A2 is produced, sir. Now what is the function of this thromboxane A2? Do you know any idea? Do you have any idea? Do you have any idea what happens? Like what this thromboxane A2 is going to do? TXA2, thromboxane A2. Sir, actually this is going to happen in the platelets, sir. Now this thromboxane A2 is going to cause a platelet aggregation. Platelet aggregation. Clot, sir. Okay, helps in the platelet aggregation. Now this prostaglandin H2, when it is acted upon by an enzyme called as, right, this prostaglandin H2, now it is acted upon by prostaglandin, okay, E2, T2, F2 synthase. Okay, now what is the enzyme? See, dekho, now the enzyme name itself is prostaglandin E2, D2, F2 alpha. This is F2 alpha synthase. Now, this prostaglandin H2 will be converted into Now this prostaglandin H2 will be converted into prostaglandin E2, prostaglandin D2 and prostaglandin F2 alpha. Okay, this is how prostaglandin E2 is produced. Prostaglandin E2, prostaglandin D2, prostaglandin F2, these are all produced because of they are all coming from prostaglandin H2 with the help of this enzyme prostaglandin E2, D2, F2 alpha synthase. Okay, now my questions for your exams. This prostaglandin E2, okay, whenever you are having pain, right, that pain is because of this prostaglandin, sir. Inflammation, pain. This prostaglandin E2 sensitizes the nerve endings, okay, causes the pain. So this is the one responsible for pain. Next, prostaglandin D2. Sir, all the prostaglandins, remember prostaglandins will cause a vasodilation, sir. Okay, prostaglandin D2, it will cause vasodilation. Vasodilation. This prostaglandin F2 alpha, it is called as carboprost. So this carboprost, again the same thing, okay, again the same thing, carboprost you will study in your gynecology, sir. Okay, so carboprost you will study in your obstetrics gynecology. Okay, there it will come. Okay, prostaglandin F2 alpha. Okay, actually it is used to it is used, it's a uterine contractant also, sir. It will cause the contractions. Okay, it's a uterine contractant also. You will study there in your obstetrics gynecology. Now prostaglandin H2, when it is acted upon by, okay, when it is acted upon by an enzyme called as prostacyclin synthase. Okay, let me write here itself. When it is acted upon by an enzyme called as prostacyclin synthase. Okay, prostacyclin synthase. Now, do you know what happens to this PGH2? Sir, prostaglandin H2, now it will be converted into PGI2. Okay, PGI2. This is called as prostacyclin. This is called as a prostacyclin. So what this will do, sir, prostacyclin, this is a very important thing. This is my favorite, prostacyclin. Now this is the one which causes the vasodilation. Okay, vasodilation during inflammation. So prostaglandin I2, prostacyclin, and it also inhibits, sir, it inhibits, sir. Now see, this prostacyclin in a normal healthy blood vessel, it causes the vasodilation and it is anti-platelet. Okay, it's anti-platelet, sir. Okay, it's anti-platelet. What does I mean by it? Inhibits platelet aggregation. Okay, it inhibits the platelet aggregation. So done. Okay. Okay. So these are the points which I want you to know. So arachidonic acid pathway. Okay, is it clear? Arachidonic acid pathway. Now here I have just, okay, let me first sum up, sir. Let me first sum up. Now देखो, first I have discussed with the cyclooxygenase pathway. Okay, I am discussing about the cyclooxygenase pathway. When the membrane phospholipids are broken down by phospholipase A2, now arachidonic acid is produced. Now when this arachidonic acid, when it is acted upon by an enzyme called as cyclooxygenase, do you know why? No, you can ask me, sir, why the cyclooxygenase is activated? Because the cyclooxygenase, देखो, what exactly happens during inflammation is maybe because of bacteria, lipopolysaccharides, okay, or interleukin 1 or TNF alpha. Okay, all these substances, they will activate this cyclooxygenase 2, sir. They will activate this enzyme called as cyclooxygenase 2, especially during pathological conditions. The cyclooxygenase 2 is activated, so arachidonic acid now gets converted into prostaglandin G2. Prostaglandin G2 will be converted into prostaglandin H2. This from here pathways differ, sir. So from here, this prostaglandin H2 can enter into the pathway of thromboxane synthesis, can enter into the pathway of prostacyclin synthesis, or can enter into the pathway of prostaglandin E2, D2, F2 synthesis. Okay, depends on the enzyme, the end product will be differ. Okay, now here, look, all this whatever I am showing you, okay, all this whatever I am showing you here, what exactly these things, sir, guys, can you tell me what exactly are these? These are the inflammatory mediators, right? They are going to cause what? They are going to cause inflammation. Now imagine, now I am having severe inflammation going on in my body. Now imagine I am having arthritis, sir, inflammation. I am having inflammation, pain. Now what you need to do as a doctor? You have to decrease my pain. So what you have to do? What you have to do with these inflammatory mediators? You have to decrease these inflammatory mediators. How can you decrease the inflammatory mediators? By giving steroids. Steroids are anti-inflammatory, you know it. Steroids are anti-inflammatory. Do you know what steroids will do? So steroids, okay, so steroids will inhibit this. Okay, steroids are going to inhibit the phospholipase A2. That's it. Okay, if you inhibit the steroid, sorry, if you inhibit the phospholipase A2, the production of this inflammatory mediators decrease, so inflammation automatically decreases. Sir, or you can inhibit the cyclooxygenase also. You can inhibit the cyclooxygenase. Who can inhibit the cyclooxygenases? Say NSAIDs, non-steroidal anti-inflammatory drugs. You know it, right? Aceclofenac, diclofenac, ibuprofen. These are the non-steroidal anti-inflammatory drugs. They decreases your pain. How they decreases your pain, sir? Because they inhibiting the cyclooxygenase. When the cyclooxygenase is inhibited, see when the cyclooxygenase is inhibited, what happens? Prostaglandin E2 production goes down. So automatically pain decreases, sir. Prostaglandin E2 causes the pain. So if you inhibit the COX pathway, prostaglandin E2 decreases, pain decreases. Okay, as simple as that. Okay, as simple as that. Okay. So prostaglandin E2 can also cause the fever, sir. Prostaglandin E2 can also cause the fever. Okay. Now, after this guys, shall we discuss about the lipoxygenase pathway? What we have discussed? Let's just recap. See, now we have discussed about this. Now we have seen how prostaglandins are getting produced, how thromboxane A2 is getting produced. Now what we have to discuss? Now we have discussed about the lipoxygenase pathway. Simple. Okay. Let's discuss about the lipoxygenase pathway. Again, same thing. I am beginning with this. Membrane phospholipids. Okay. Lipoxygenase pathway. Okay, lipoxygenase pathway, sir. Now let's begin with membrane phospholipids. Now this membrane phospholipids, tell me what happens. With the help of enzyme phospholipase A2, see, now it's going to be broken down into arachidonic acid. Now this arachidonic acid, now this arachidonic acid, it is acted upon by lipoxygenases. How many types of lipoxygenases are there? There are two types of lipoxygenases. What are these two types of lipoxygenases? 5 lipoxygenase, 12 lipoxygenase, 5 LOX and 12 LOX, 5 lipoxygenase and 12 lipoxygenase. Okay, so two types of lipoxygenases, sir. Now when it is acted upon by 5 lipoxygenase, guys, Reen, one more. Now tell me what happens if it is acted upon by 5 lipoxygenase. Which substance is going to be produced? Which leukotriene is going to be produced? Which leukotriene is going to be produced? Sir, LTA4 is going to be produced. If it is acted upon by 12 lipoxygenase, okay, first we will come to the 12 later. First let's discuss about the 5 lipoxygenase. Sir, now arachidonic acid, now it is acted upon by 5 lipoxygenase. Now LTA4 is produced. Now do you know what happens? Sir, now this LTA4, look, now this LTA4, it can be acted upon by, okay, now it can be acted upon by LTC4 synthase. There is an enzyme called as LTC4 synthase. Okay, LTC4 synthase. So now leukotriene C4 is produced. Okay, leukotriene C4. Okay, that's a leukotriene C4, sir. Okay. Now leukotriene C4 is produced. Now this leukotriene C4, it can be converted into leukotriene D4. Now this leukotriene D4 can be converted into leukotriene E4 with the help of different enzymes. Okay, with the help of different enzymes, the leukotriene C4 will be converted to leukotriene D4, leukotriene E4. That enzymes, that's a total biochemistry thing. Sir, if you want me to write, yes, the gamma glutamyl transferase, the gamma glutamyl transferase. Okay, gamma glutamyl transferase is going to convert the leukotriene C4 into leukotriene D4. The leukotriene D4 will be converted into leukotriene E4 with the help of enzyme dipeptidase. Okay, dipeptidase, which are not that important for you. The point which I want you to know is the arachidonic acid, it enters into the pathway of leukotrienes. Okay, it enters into the pathway of 5 lipoxygenase pathway. Then first who is produced? Leukotriene A4 is produced. So this leukotriene A4, now if it is acted upon by an enzyme called as leukotriene C4 synthase, who is going to be produced? Leukotriene C4. C4 will be converted into D4. D4 will be converted into E4. Okay. Now, if this leukotriene A4, if it is acted upon by an enzyme called as leukotriene A4 hydrolase. Okay, leukotriene A4 hydrolase, then which leukotriene is going to be produced? Leukotriene B4 is going to be produced. This is how LTB4 is produced. Leukotriene B4. Okay, so this is how the leukotrienes are produced. One point I want you to know is, so this leukotriene B4 is also going to be helpful in chemoattractant. It's also a chemoattractant, sir. It's also going to recruit the neutrophils. So it is also helping in chemotaxis. It's helping in the chemotaxis. Done? Now, look. If this arachidonic acid, if it is acted upon by 12-lipoxygenase, if it is acted upon by 12-lipoxygenase, what will happen? Now lipoxins are produced, sir. Okay, lipoxin A4, okay, lipoxin XA4, lipoxin XB4. These are the substances which are produced. Okay, so 12-lipoxygenase, if it is entering into the pathway of 12-lipoxygenase, then lipoxins are produced. Remember, these lipoxins, they are anti-inflammatory. Okay, they are anti-inflammatory, sir. Okay, these lipoxins are anti-inflammatory. So this is how the leukotrienes are produced. The important point about them is these leukotrienes, these leukotrienes, not only this also, these are, they are the potent, right? Potent bronchoconstrictors. They are the potent bronchoconstrictors. They will cause bronchoconstriction. They are the potent bronchoconstrictors, sir. Okay? Yeah. Completed. Okay, they are the potent bronchoconstrictors. So with this, what we have completed? We have completed everything. See, arachidonic acid, it is going into the pathway of cyclooxygenase and it is going into the pathway of lipoxygenase. So we have seen the prostaglandin synthesis as well as leukotriene synthesis. Completed. Okay, those two are the ones which will come in your exams. So, look, see, we have discussed about what? We have discussed about nitric oxide, all arachidonic acid metabolites we have discussed, chemokines completed, cytokines completed, we have discussed about the platelet activating factor, and reactive oxygen species means you know it, okay, they are the free radicals. Okay, anyway, there is nothing to discuss specific about them. Now, what we have completed at the end of the day, we have completed all the cell-derived inflammatory mediators. The preformed mediators as well as newly synthesized mediators. So what we are left with? What we are left with? Sir, we are left with plasma derived things. Okay, plasma derived things, sir. Okay, we are left with the plasma derived things. Now, guys, shall we take a 5 minutes break? Guys, shall we take a 5 minutes break and continue? Okay, we'll just take a 5 minutes break, and after the break, we'll continue about the plasma derived mediators. Okay, plasma derived inflammatory mediators will be discussed after the break. Okay, 5 minutes break. Okay. Okay guys, welcome back. Now what we are discussing? We have completed the arachidonic acid metabolites. Now what we have discussed? We have to discuss the complement system. Okay. Now let's begin with the complement system. Right. Complement system. Most of the students, they will confuse between complement system and coagulation cascade. Complement system is totally different thing. It's an immune thing. Okay, it's an immune thing. There are certain proteins in your plasma, sir, which are called as the complement proteins. These are the complement proteins: C1, C2, C3, C4, C5, C6, C7, C8, C9. There are these complement proteins present. Whenever there is an infection, these complement proteins are activated. Once the complement proteins are activated, they will start to kill the organisms. They will kill the bacteria. Okay, so complement system, it's a more kind of immune thing. Clotting is different. Okay, clotting is different. They are going to form the blood, clot to prevent the blood loss. Okay, now in this complement system, what I want you to know, there you go guys, here in this image you can clearly see. So the complement system, see the complement system, it can be activated by three pathways. There are three pathways with which the complement system is activated. So what are these three pathways? There you go, classical pathway, alternate pathway, and there is also one more pathway called as the lectin pathway. Okay, mannose binding lectin pathway. So for your exams, mainly you need to know about the classical pathway and alternate pathway, sir. Mainly the two important pathways by which the complement systems are getting activated. Now first itself I am telling you, see, first itself I am telling you, once the complement system is activated, at the end of the day, देखो, sir, complements are getting activated, there is something called a C3 convertase, C5 convertase. At the end of the day, look, C5b to C9, C5b to C9. Do you know what is this C5b to C9? I will tell you in detail, one by one we will go. Do you know what is this C5b to C9, sir? This is something called as MAC, membrane attack complex. At the end of the day, once the complement system is activated, doesn't matter whether it is by classical pathway or alternate pathway, doesn't matter. At the end of the day, who is going to be produced? Membrane attack complex is going to be produced. This membrane attack complex is going to cause cell lysis, cell death. Which is cell death? Bacterial death. Okay, it's going to kill the bacteria, it's going to kill the microbes. Okay, so this is the point which I want you to know. So complement system, it is activated by three pathways. First, right, one by one. It's activated by how many pathways? Classical pathway, classical pathway. The second pathway is alternate pathway. Okay, alternate pathway. And the third pathway is lectin pathway. Okay, mannose binding lectin pathway. Mannose binding lectin. Okay, mannose binding lectin pathway. Okay, these are the three pathways. So at the end of the day, because of the activation of this, okay, complements are activated, sir. At the end of the day, who is going to be formed? Membrane attack complex will be formed. So what exactly is membrane attack complex? C5b to 9. Okay, C5b to C9. Okay, C5b to C9. Sir, you will get it out. Sir, what is this C5b to C9, sir? Don't worry, I will explain you. Okay, these are the complement proteins. So these complement proteins are going to form the membrane attack complex. This membrane attack complex, it puts pores, sir. It's like a drilling mission. This membrane attack complex is like a drilling mission. It puts holes into the cell membrane of the bacteria, so that what happens? Now more and more water will go into the bacteria is going to become swollen, it's going to be like in a total water balloon, it's going to burst away, right? So this membrane attack complex, it will put holes in cell membranes. Okay, it's going to put the holes in the cell membrane. So because of that, the bacteria will swell, I will show everything, and it's going to be killed. It's going to be killed, sir. So now, having said that, first let's begin from the basics. Okay, let's begin from the basics. So what is a complement pathway? Right, complement. Okay, complement pathway. But let me show you the diagram once. In between, some important things are there. Dekho, complement pathway, sir. Okay, complement system, the classical pathway. First I am going to discuss about the classical pathway. Okay, not complement pathway, sorry, the classical pathway. Okay, classical pathway. Now in the middle, in our journey, what we will see is, we will encounter the word C3 convertase, we will encounter the word C5 convertase. Okay, just I am telling you. Okay, the topic now we are going to discuss that, sir. Classical pathway is going to activate C3 convertase. C3 convertase after C5 convertase. At the end of the day, MAC is going to be produced. Okay, just showing you. Okay, now let's take the bacteria, sir. Now we have to draw the bacteria. Okay, now let's the bacteria. See, this is the bacteria, bad guy. Now he's very sad, sir. Now he's very sad. Okay, he's very sad. Do you know why? Because we are going to kill him. How? By the classical pathway. So what exactly is classical pathway? Sir, classical pathway, it is activated by IgG and IgM antibodies. GM. I used to remember something like, there is a famous mnemonic GM, General Motors. You know, right? The General Motors which makes the cars in the foreign countries. General Motors, mainly in the US. General Motors makes classical cars. General Motors make the classical cars. I have read it. Like, it's a very famous mnemonic from a very great teacher. So, the classical pathway is going to be activated. The classical pathway is going to be activated because of this these antibodies. Now, where are these antibodies, sir? Now, these antibodies, now these antibodies, they are bonding with the antigen. See, now this is the antibody. Which antibody? IgG antibody or IgM antibody. Okay, IgG antibody or IgM antibody. Now, they came and now they are binding with the antigen. Okay, now they are binding with the antigen on the bacterial surface. Now, do you know what it will do? Now, this antigen antibody complex, now this antibody is going to activate the complement proteins. Where are the complement proteins present? So, the complement proteins are present in our plasma. There are many complement proteins present in the plasma, sir. Okay, now these complement proteins are going to be activated. These complement proteins, they will also come into the tissue because of the leakage. Even these complement proteins came into the tissue, sir. Now, what happens, sir? This IgG antibody or IgM antibody, first what it will do is it will activate the complement number 1. Okay, it's activating the complement number 1, C1. Okay, now what this C1 will do? Actually, this is C1q, but anyway, it is activating the complement number 1, protein number 1. So, the C1, now it is going to activate complement number 2 and 4. Okay, complement number 2 and complement number 4. So, previously these complements are inactive. They are always sleeping, sir. The complements are sleeping. Now, let me tell you one thing. Once, for example, if this is C1, okay, if you activate the C1, it is going to be converted into C1a and C1b. It's going to split into 2 parts. Same thing. If you activate, see this is C2. Imagine this is C2. It is inactive, sir. If you activate it, it is going to split into 2 parts. C2a and C2b. Same with C5 also. C3, C4, same with everyone. Once you activate a inactive complement protein, see these are the inactive complement proteins. Once you cleave them, now once you activate them, they are going to cleave into C1a, C1b, C2a, C2b, C3a, C4b, C4a, C5b, something like that. Okay. Now, what you are doing? So, this antigen antibody complex, along with the C1, what it is going to do? So, it is going to activate which complements? C2, C4. Now, C2, C4 are activated, sir. Now, they will be converted into what? Now, they will be converted into C2a, C2b, C4a, C4b. Now, I am only taking, see, the C4b, now C4b and C2a, these subunits I am taking. Now, they will bind. Now, they are going to be called as, the C4b, C2a. Now, the C4b, C2a, now this molecule, it is called as C3 convertase. Okay, now you understood what is C3 convertase? So, C3 convertase is nothing but these activated complements. These activated complements are C4b, C2a. Now, together it is working as an enzyme. It is going to work as an enzyme. What is the enzyme name? The enzyme name is called as C3 convertase. The name itself is there. What it is doing? It is going to convert inactive C3 into active C3. So, what is going to happen? Look. Sir, the inactive C3 is converted into active C3, that is C3a, C4b. Okay, C3a, C4b. Okay, now it is going to be converted into C3a, sir, plus C4b. Now, here we are taking this 3b, sir. Now, we are going to take this. Okay, now we are going to take C3a and, sorry, now just clear this, C3a and C3b. Okay, C3a, C3b. Now, we are going to take this 3b. Now we are going to take this 3b, sir. Now, right, this 3b, now the same thing. Okay, now the same thing. C4b, 2a, 3b. Same, this 2a. Okay, I am talking about this 2a, sir. Now, C4b, 2a, this 3b, C3b. Now, they all will fuse. Now, they all will act like an enzyme again. This C3b is coming and binding, sir. Now, this molecule, this C4b, 2a, 3b. Okay, the C4b, 2a, 3b, this molecule is called as now C5 convertase. C5 convertase means what? It's going to activate C5. C5. Already we have activated C1, C1 activated, C2 activated, C3 activated, C4 activated, everything is activated, sir. Okay. Now, this C5 convertase, do you know what it will do? The C5 convertase. Now, it is going to convert inactive C5. See, for example, now the inactive C5, so this is inactive C5. It is converted into C5A and C5B. Now this is our hero. The hero is the C5B, sir. This C5B is the hero. Once C5B is activated, do you know what it will do? It will activate C6, C7, C8, C9. So now the C5B, it is going to fuse with, C6, C7, C8, C9. Okay. So C3, C5B, C6, C7, C8, C9. Now all of them, they will fuse. Sir. Now this is a drilling mission now. Now it is going to form what? They will all fuse and they are going to form a channel kind of thing which is called as membrane attack complex. Now this is the membrane attack complex. Now tell me, what exactly is membrane attack complex made up of? The membrane attack complex is made up of C5b, C6, C7, C8, C9. So C5b to C9, this is called as membrane attack complex. Do you know what this membrane attack complex is going to do? Now it's like a drilling machine. Now it will put holes. Now this is the membrane attack complex. Now it's going to put holes, sir. Thousands and thousands of membrane attack complex are going to be produced. See, now everywhere holes in the cell membrane. Now through these holes what happens? Now water will start to enter into the cell. Okay, water will start to enter into the cell. So bacteria will become swollen. Now bacteria is becoming like a water balloon. Now it will swell and it will burst away. The bacteria will be killed, sir. So this is the classical pathway, sir. The classical pathway. Okay. In the classical pathway, what they will ask in your exam is the questions: what is the C3 convertase and what is the C5 convertase? C3 convertase is what? C3 convertase is C4b and C2a. C4b and C2a is the C3 convertase. And what is the C5 convertase? C4b, C2a and 3b. C4b, 2a, 3b. Which means C4b, C2a, C3b. All these molecules together, they work like an enzyme. C5 convertase converts inactive C5 into active C5. So the C5, the C5b component is going to fuse with C6, C7, C8, C9. They forms a membrane attack complex. They are going to form a pore. They will drill, sir. They will put the holes into the cell membrane of the bacteria and they will kill the bacteria. Right? So classical pathway is completed. Sir. Okay. Now after this, small pathway. Okay. After this, let's discuss about the alternate pathway. Okay. Now let's discuss about alternate pathway. Okay. Alternate pathway. So what you need to know regarding the alternate pathway? Again, let's take the same thing. Same bacteria, sir. Again, the bacteria is very sad. Okay, why the bacteria is sad? Because it's going to be killed. How, sir? Now, this alternate pathway is acted upon by again antibody. Okay, again antibody, but it's a different antibody now. It is IgA antibody. Okay, now I am taking IgA antibody. Now this IgA antibody, what it will do? Sir, now this IgA antibody, this is antigen. Now this antigen antibody complex, right? Now the antibody is binding to the antigen. Now this IgA antibody is going to activate C3. Okay, it's going to activate C3, complement protein C3. So C3 will be converted into C3 and C3b. Now let's talk about the C3b. Now C3b is activated. Sorry, so C3 is activated. So C3 is converted into C3A and C3B. Now this is the C3B. Now what this C3B will do? The C3B is going to bind with something called as factor 3. Factor 3, sir. Okay, these are different things. These are not the complement proteins. These are the factor 3. There is something called as a factor 3. Now when C3B is acting on factor B, see normally factor B is also inactive. Factor B, it's inactive. Now this C3B, it acts on factor B, so that factor B is also going to be converted into, okay, this factor B. So this is the factor B. Factor B is going to be converted into BA and BB. Okay, so two components will come, right? Factor B is inactive. So factor B, when it is activated, factor BA and factor BB will come. Okay, so now what happens is, so look, this C3B, it's acting on factor B. Now when it is acting on factor B, who will come? See, now B is there, BA gone, BB is there. Now this is active. Now the C3B binds with this BB. C3B is going to bind with this BB. Okay, this is MCQ, sir. C3B BB. Now the C3B BB is called as C3 convertase. Now this is what? This is C3 convertase. Now C3 convertase is produced. Now in alternate pathway, the C3 convertase, let me write first here, this is C3 convertase. Okay, now in alternate pathway, C3 convertase is different. In classical pathway, dekho, this is C3 convertase, sir. The C3 convertase is C4B, C2A. Okay, C4B, 2A, C4B, 2A, C4B, 2A. Just forget about the C. C4B, 2A. That's the C3 convertase. In alternate pathway, what is happening? IgA antibody first activates the C3. C3 is going to be cleaved into C3A, C3B. Now here C3B came. Now the C3B is going to react with the factor B. Factor B is activated. So factor B is going to be split into BA and BB. Forget about the BA. Now we are talking about the BB. Now the C3B is going to bind with BB. Now this is called as C3 convertase. Now what it will do? So what it will do, sir? It will convert C3. Again, this is a new C3 molecule. This C3 will be converted into C3A and C3B. Okay, C3A and C3B. Okay, C3A and C3B. Now again you are going to take this C3B. Okay, now B are important, sir. Now here again we are going to take this C3B. Now what happens? See, the same, this is coming, sir. Now C3B, BB, and now this C3B, now this 3B, now this 3B. Okay, now they are going to fuse. Now they are going to fuse and now they will act like an enzyme. Now which enzymes are this one? This is your C5 convertase. Now this is your C5 convertase. Now this is your C5 convertase. Now what the C5 convertase will do? Sir, now the C5 convertase is going to convert inactive C5 into, now the C5 convertase, what it will do? Now it will convert C5 complement protein number 5 into C5A and C5B. Now hero came, sir. Now this is the hero. C5B is the hero. Now I told you, whenever C5B comes, C5B is going to bind with C6, 7, 8, 9. What it will form? C5 to C9, C5B to C9. Now they are going to form what? Now they are going to form membrane attack complex. Okay, now they are going to form the membrane attack complex. What a MAC will do? Membrane attack complex. It is going to put holes in the cell. Now the cell is, say, dying because now it is keeping lots and lots of drills, sir, into the cell. So what happens? Water will come into the cell. Now the cell will become swollen and the cell will be ruptured, blast away. So this is the alternate pathway. So this is how the alternate pathway works. At the end of the day, doesn't matter whether it is classical pathway or alternate pathway or lectin pathway. Okay, mannose binding lectin pathway. At the end of the day, who should be produced? It's the membrane attack complex. The membrane attack complex should be produced. The membrane attack complex is from C5B to C9. What the membrane attack complex is doing? It will drill the holes into the cell membrane, causing the cell to swell and blast away. The bacteria is dead, sir. So I have discussed about the classical pathway as well as alternate pathway. Done. Okay, classical pathway as well as alternate pathway are done. Now some important questions, direct questions which will come in your exam is, sir, complement system, is it good or bad? Just tell me. Sir, complement system is good. It is killing the bacteria. It's killing the bacteria, helping in the inflammation. Okay. Now most common complement deficiency. Most common complement deficiency, sir. The most common complement deficiency is C2. Okay, question. Now, membrane attack complex. Just tell me membrane attack complex is from C5 to C5b to C9. Okay, C5b to C9 forms the membrane attack complex. Now, chemotactic agents. Chemotaxis. Okay, who are going to help you in the chemotaxis? See, during this classical pathway, so look at here, during this classical pathway and alternate pathway, what we have produced, sir? Dekho, we have produced the C5A, right? C5A. What is the function of the C5A? Now here also see, we have produced the C5A. That the C5A, it recruits more and more neutrophils to the area of inflammation. So C5A is a chemotactic agent, C5A, sir. Okay, C5A is the chemotactic agents. Now, what are opsonins? What are opsonins which are produced? What are the opsonins which are produced during this complement activation? Complement activation. See, during this pathway, we have produced the C3b, right? See, this C3b molecule is getting produced. See, this C3b molecule, guys, listen. This C3b molecule and C4b, C5b, all B's. C3b, C4b, C5b, especially the C3b's are important. The C3b molecule, it will also act like an opsonin. You know, right? Opsonin. Opsonin means like a decoration, decorating the bacteria so that more and more macrophages will come and eat the bacteria. Okay, so the C3b molecule, they will go and fall on the bacteria so that now macrophages will easily recognize the bacteria and do the phagocytosis. So the C3b molecule, C3b, C4b, C5b, all these are opsonins. Okay, all these are the opsonins. Now, there are certain diseases where the complement proteins will be deficient. Okay, for example, if membrane attack complex, MAC, if the membrane attack complex, if it is deficient, if it is not forming, okay, that will cause what? That will cause recurrent capsulated organism infections. Capsulated infections with capsulated organisms. Okay, infections with the capsulated organisms, especially which organism? Neisseria. Neisseria gonorrhea. Okay, so Neisseria gonorrheal infections, sir. Okay, Neisseria infections will occur. Okay, Neisseria infections will occur, sir. MAC deficiency. Okay, now normally unnecessarily complements are not supposed to be activated, sir. Okay, unnecessarily complements are not supposed to be activated. Once if they are activated, again they need to be inactivated. There is something called as C1 inhibitor. C1 inhibitor means the C1 inhibitor is inhibiting the complements. It's inhibiting the complements. Unnecessarily we don't want the complements, sir. Now with this C1 inhibitor, if it is deficient, question asked, it is going to cause angioedema. Okay, it's going to cause what? Angioedema, sir. So complement number C1 to 4. Complement number 1, complement number 2, complement number 4. If they are deficient, it's going to cause SLE. Okay, it's seen in SLE, sir. Okay, it's seen in SLE. So these are some important MCQs which I want you to know. Especially this is a question which was asked. C1 inhibitor deficiency is going to cause angioedema. Membrane attack complex, that is C5b2 C9 deficiency is going to cause recurrent infections with the capsulated organisms, especially Neisseria infections. Okay, Neisseria meningitis infections. Now opsonins are C3b, chemotactic agent is C5a, MAC is from C5b to C9, and most common complement deficiency is C2. So with this, complement system is also completed. The clotting cascade will be discussed separately in the hemodynamics, like in the vascular pathology. In the vascular pathology, I will discuss about the clotting. Now with this, the inflammatory mediators are, okay, such a big topic, entire inflammatory mediators are completed. Now in the next video, we'll continue with the chronic inflammation. In the next video, in the tomorrow's video, we'll be continuing about the chronic inflammation, granuloma formation, the wound healing in the tomorrow's video. So today we have discussed about the inflammatory mediators and in detail about the inflammatory mediators. Hope the video is helpful. Hope the lecture is helpful. See you in the tomorrow's class. Okay, see you guys in the tomorrow's class. Good night for today. Goodbye.